Imagine this. In the fall of 2025, something completely unexpected happened. A single change to a visa program, and suddenly, the entire American healthcare system was on high alert. We're not talking about a new law on insurance or anything like that. Nope. This was about immigration fees, and it threatened to just sever this critical lifeline of doctors, putting care at risk for folks in some of the most remote and vulnerable parts of our country. So today, we're going to peel back the layers on this. We'll see how this one policy change exposed a hidden but absolutely essential part of American medicine and basically forced our whole system to a breaking point.
All right, so here's our game plan. First, we'll talk about America's hidden doctors. Who are they? Then, we'll deconstruct the H-1B visa itself. After that, we'll look at what we're calling healthcare's invisible backbone. Then comes the big one, the $100,000 shockwave. We'll project the fallout from that and wrap it all up with where we stand now, a system at a crossroads. Let's get into it.
Okay, first up, America's hidden doctors. You know, to really get what's going on here, we have to look beyond the big city hospitals we always hear about. We need to focus on the parts of America that, frankly, don't always get the spotlight. Because that's where this story really begins, with the quiet, absolutely essential work happening there day in and day out.
So let's start with a really basic but powerful question. Think about it. Who is providing care in America's most underserved communities? You know, the places where finding a doctor is a real challenge? We're talking small rural towns or struggling neighborhoods in big cities. Who's actually staffing those clinics? Who's there to deliver the babies or handle emergencies? Well, the answer might actually shock you. For a huge number of people, the answer is a doctor who is trained outside the United States. Get this, we're talking about 21 million Americans. 21 million people live in places where at least half of all the doctors are foreign trained. For these folks, this isn't some abstract political debate happening in Washington. No, this is about whether the clinic down the street is going to be open next week. It's that real.
And look, this isn't just happening in a few specific spots. If you zoom out and look at the whole country, these doctors, they're often called international medical graduates, or IMGs for short. They make up a full quarter of our entire physician workforce, 1 in 4 doctors. So they're not just a backup plan or some kind of supplement. They are a foundational pillar of American medicine. They're the ones filling the critical gaps, especially in areas like primary care and psychiatry, specialties that, for a variety of reasons, many U.S. grads tend to move away from.
Right, so that leads to the next question. How do these incredibly skilled doctors end up working everywhere from big city hospitals to rural clinics in the Dakotas? Well, there are a few different ways, but a major one is through the H-1B visa. And yeah, when you hear H-1B, you probably think tech workers in Silicon Valley, not doctors. But it's a huge part of the story.
So what exactly is an H-1B visa? At its core, it's a special type of visa for what the government calls specialty occupations. Now, that's just a fancy way of saying jobs that require very specific advanced knowledge. The bare minimum is a bachelor's degree. So you're thinking engineers, IT specialists, accountants, and, you guessed it, doctors. For a hospital, or any employer really, this is the main tool in their toolbox for bringing in professional talent from abroad when they just can't find that talent here at home.
And this whole thing is not new. The H-1B program has been around since 1990. What's really interesting when you look at its history is that it basically acts like a barometer for the U.S. economy's needs. See here, during the dot-com boom in the late 90s and early 2000s, the cap on these visas shot up because we were desperate for tech talent. Then it settled back down. The point is, for decades, Congress has used the H-1B as this flexible tool to fill whatever critical gaps we had in our workforce. And it's that stability, that predictability, that's so important to remember as this story unfolds.
Okay, now let's look at who's actually getting these visas. This data from 2020 is pretty revealing. You can see right away, yeah, the top field is computer-related, no surprise there. And the top country of birth is India. But look at the education level. Almost half of the people getting these visas have a master's degree. And the median salary? Over $100,000. So if anyone tries to tell you this is some kind of cheap labor program, the data just doesn't back that up. This is a pipeline for bringing in highly educated, high-earning professionals that the U.S. is in a global competition for.
All right, so we've established that the H-1B is this big program for high-level talent. But what's fascinating is that there's this tiny little sliver of the program that has a huge, an absolutely critical role in keeping our whole healthcare system from falling apart. It really is an invisible backbone. And when you look at the numbers, you might think I'm exaggerating. In 2020, medicine and health accounted for just 3.6% of all H-1B petitions. It's a tiny slice of the pie. But here's the thing. It's not about the size of the slice. It's about where that slice is being used.
Think of it like a linchpin in a machine. It might be small, but without it, the whole thing grinds to a halt.
Now let's narrow our focus even more, just on doctors. A really important study from 2024, published in JAMA, found that H-1B doctors make up less than 1%, 0.97% to be exact, of all doctors in the U.S. And at first you hear that and think, okay, less than 1%? Come on, how important can that really be? But that number, that national average, it's incredibly deceptive. It's hiding what's really going on.
And this map tells the real story. This is why that national average is so misleading. You see, it's not an even sprinkle of doctors across the country. Not at all. You see these deep, dark pockets of concentration, right? They're in the Midwest, the South, in rural areas. Exactly the places that have the hardest time attracting doctors trained in the U.S. For communities in these areas, H-1B doctors aren't just filling gaps. They literally are the local healthcare system.
And that same study from JAMA dug even deeper, and the data is just, wow. Take a look. In rural counties, the dependency on H-1B doctors is almost twice as high as in urban ones. But the really staggering part is the poverty connection. The absolute poorest counties in this country rely on H-1B doctors at a rate nearly 4 times higher than the richest counties. This is not random. It's a system, an invisible one maybe, that has been acting like a lifeline, sending doctors exactly where they are needed most.
Okay, so let's recap where we are. We've got this quiet, stable system that's been working for decades, funneling these essential doctors into the communities that need them the most. It's an invisible lifeline. And then September 19th, 2025 happened, and that lifeline was put on the chopping block by a policy change that nobody, and I mean nobody, saw coming.
It came in the form of a presidential proclamation. And just like that, the entire ground shifted under the feet of hospital administrators across the country. This wasn't just some tweak to the rules, it fundamentally changed the economics of hiring an international doctor. And get this, it was announced on September 19th and it went into effect on the 21st. 2 days' notice. Can you imagine? You're running a small rural clinic, your budget is set for the entire year, and you get a memo saying the cost of hiring that new family doctor you desperately need just exploded.
And when I say exploded, I'm not kidding. The change was just breathtaking. The application fee for a new H-1B petition used to be around $4,500, a manageable cost. The new fee, $100,000. Let me say that again. From about $4,500 to $100,000. That is not a typo. It's a more than 20 times increase basically overnight. Think about what that means for a small cash-strapped hospital. Hiring one new doctor, when you factor in their salary, suddenly looks like a $250,000 decision. It's just impossible.
You can bet the reaction from the medical world was fast, and it was furious. The American Medical Association, the AMA, they didn't pull any punches. Their president, Dr. Bobby Mukamala, came right out and said it. This fee wouldn't just make things difficult. He said it could literally choke off the entire pipeline of international doctors. Strong words.
And it wasn't just doctors saying this. Experts who study this stuff, like Aram Alam from Harvard, put it in even more direct, more chilling terms. She basically said, listen, if you think this is about creating jobs for American doctors, you're completely missing the point. The real result, she said, won't be new jobs. It will be shuttered clinics and lives lost. I mean, it doesn't get much more serious than that.
So what does choking off the pipeline actually look like on the ground? What are the ripple effects when that flow of doctors just stops? What happens to the hospitals, to the communities, to the patients? Let's project some of that fallout.
The first thing you have to understand is that this whole situation didn't just appear out of nowhere. It happened against a backdrop of a really serious and growing doctor shortage in America. I mean, the Association of American Medical Colleges was already sounding the alarm, projecting we could be short as many as 86,000 doctors by 2036. We were already in a tough spot. So this policy, it was like throwing gasoline on a fire. Or maybe a better way to put it, it was like shutting off the water mains during a record-breaking drought. And the immediate consequences were not hard to predict. It's a pretty clear chain reaction, right? First, the hospitals that depend on these doctors the most, rural hospitals, public safety net hospitals, are the ones that can least afford a $100,000 fee. So they stop hiring. That means residency spots in crucial areas like primary care go unfilled. For patients, that means it gets harder and harder to see a doctor. Wait times get longer, you have to drive further, and for the doctors and nurses already there, they get stretched thinner and thinner, leading to burnout. It's a vicious cycle that could easily end with clinics having to close their doors for good.
So this policy shock really forced everyone's hand. It sparked this huge, urgent conversation across the country. And pretty quickly, it became clear this wasn't really about a visa fee. It was about something much bigger, the whole way our medical workforce is built. It was about our reliance on foreign-trained doctors and, maybe more importantly, our failure for decades to really build up our own domestic pipeline.
And what happened next was, well, it's kind of a mess. You can see it in the timeline. The White House issues the proclamation on the 19th. Immediately you have the AMA, the hospital associations, everyone screaming for an exemption for doctors. The response from the administration was confusing, to say the least. First, a statement says doctors may be exempt on a case-by-case basis. Then another clarification says the fee only applies to new applicants from outside the U.S. The result was just chaos and uncertainty. And for a hospital trying to plan its staffing for the next year, that kind of uncertainty is absolutely paralyzing.
When the dust started to settle a bit, it became clear there were two paths forward. First, there's the short-term fix, the emergency triage, if you will. That's granting a clear, predictable, no-nonsense waiver for all essential healthcare workers. Basically, stop the bleeding. But then there's the long-term solution, the harder, more complex one, and that's to finally tackle the root cause of this whole problem. We need to expand our own U.S. medical schools and residency slots. For a long, long time, we've basically been using international doctors as a band-aid to cover up for the fact that we're just not training enough of our own.
And that's really what this all boils down to. This whole mess forces us to ask a really fundamental question. We clearly rely on this global pool of brilliant, skilled doctors to take care of us, especially in our most vulnerable communities. A doctor's ability to heal, that's universal. But their ability to get here to do that job is anything but. So the question we're left with is this. Should a doctor's ability to save a life in a small town in America really depend on the unpredictable politics and the insane costs of a visa? How we answer that question, well, that's going to shape the future of healthcare for millions of Americans.